Welcome to The Explainer. Today, we're jumping into a fascinating case study about how to make health check actually work. Not just in a perfect lab, but in the messy, high-stakes reality of a busy hospital. We're going to look beyond the ones and zeros and get to the human side of real digital transformation. So let's get right to the heart of it. Why does so much health tech fail? Hospitals and clinics spend millions, sometimes hundreds of millions, on amazing new technology that promises to change everything, only to have it sit there, gathering digital dust, because the very people it's supposed to help just resist it. What is going on here? While this iceberg metaphor just nails the problem, so many organizations fall into this trap. They think that just because they bought a big, expensive electronic health record, an EHR, they're now digitized. That's the part of the iceberg you see, right? The software, the servers. But the real danger, the part that sinks the whole project, is everything hiding beneath the surface. The burnout, the pushback, the total workflow chaos. And this is what that chaos looks like. When you force a new system onto people without truly understanding their day-to-day work, it doesn't solve problems, it becomes the problem. You get this massive digital burnout, this administrative tax that pulls doctors away from their patients. And that, of course, leads to resistance, which then tanks the quality of your data. It's a vicious cycle. Okay, and here's where things go from bad to critical. Think of a hospital as having two giant engines. You've got the clinical side, focused on healing patients, and the financial side, focused on keeping the lights on. When these two sides aren't talking, when they're stuck in their own silos, the data flow between them just completely breaks down. The result of that breakdown? It's not just a slowdown. The entire operation freezes. Literally, clinical departments start building up these huge backlogs of frozen cases, and that essential link between providing care and actually getting paid for it is completely severed. The whole system just grinds to a halt. So how in the world do you thaw out a frozen system? As we're about to see, it's not about throwing more money or more software at it. It required a really smart strategic pivot, a completely new way of thinking about the technology itself. And the solution began with this simple but honestly really profound shift in mindset. The old way of seeing the EHR was as a passive medical diary. Just a digital filing cabinet for notes. But the new reality, the big change, was to see it as the active, living, breathing, operational backbone of the entire hospital. And this is what that pivot looks like in practice. The goal was to transform that EHR from a dusty old record book into a dynamic, real-time dashboard connecting absolutely everything: billing, the pharmacy, admissions, labs. The EHR had to become the one single source of truth for everyone. So, a new philosophy is great, but how do you actually do it? This is where it gets really clever. It wasn't just about new tech. It was about this powerful two-pronged attack they called hard rules, soft power. It's this awesome combination of cold, hard system logic and smart human psychology. First up, the hard rule. They built this simple, totally non-negotiable lock right into the system. Look at how it works. Clinical data gets entered, and then the system asks a question. Is it complete and accurate? If the answer's no, boom, system lock. No financial clearance, no new patient admissions, period. All of a sudden, getting the data right wasn't just a suggestion, it was essential for the hospital to even function. But here's the thing, a system lock by itself isn't enough. You can't just order around highly trained elite doctors who are already overworked. They're just going to see it as another bureaucratic hoop to jump through. No, you have to convince them. And how do you convince them? With data. And that brings us to the soft power part of the equation. They completely moved away from those top-down, authoritarian orders. Instead of punishment, they leaned into transparency. The solution was simple but brilliant. Every single morning, all the clinical leaders got a straightforward, data-driven report showing exactly where each department stood on compliance. And the psychological effect of this was powerful. Look at this chart. If you're the head of the oncology or emergency department, you do not want to be in that red zone, day after day, for all of your peers to see. It wasn't a punishment from above, it was just good old-fashioned peer pressure. It basically turned compliance into a game. And the change was wow. It was almost immediate. The EHR went from being this annoying thing that was IT's problem to being a core performance metric that every department had owned. We're talking within hours of sending out these reports. Departments that were lagging behind started catching up. Real-time updates became the norm, not the exception. So, after all that hard work, the system locks, the daily reports, what was the ultimate payoff? This brings us to the final piece, the vision for tomorrow. Because getting all this data right wasn't just about fixing today's problems. It was about building the foundation for the future. And this staircase to innovation shows that journey beautifully. Yeah, that first step, just getting digitized, it's a real struggle. And the next step, getting your data clean and getting compliance up, that's hard work. But the final step, that's the reward. That's where you get embedded AI. We're talking about tools that can draft a doctor's clinical notes, summarize a patient's entire history, and actively fight physician burnout. The technology finally starts working for the doctors instead of the other way around. So when you boil it all down, what's the secret sauce? It comes down to this really elegant formula. True, meaningful innovation in healthcare is the sum of these three crucial parts: clinical context, operational rigor, and human empathy. So what does that actually mean? Well, clinical context means you actually get what a doctor's day is like. Operational rigor means you use those hard system gates to make good data non-negotiable. And finally, human empathy means you have the wisdom to use soft power, like transparency instead of punishment, to get everyone on board. That's how you drive real efficiency that protects resources and saves lives. And that leaves us with this final, really important question to think about. Is your innovation just about code, or is it about culture? Because what this case study proves, beyond a shadow of a doubt, is that real, lasting change isn't about writing a better algorithm or buying a faster server. It's about changing the culture. The real question for any of us isn't just what we're building, but how we're building it with the people who have to live with it every single day.